Hi, I wanted to do a follow-up post after a recent video we put out explaining bioidentical hormones. A question had been posed about bioidentical hormones in the context of having decreased energy, vigor, difficulty losing weight, and poor libido. And at the end of that video, I had alluded to how it is important to have a comprehensive evaluation that goes beyond what is usually performed in a conventional medicine practice. Bioidentical hormones work well, but most people will not need them to overcome energy, weight loss, or libido problems. All exogenous hormones, bioidentical or not, can cause unwanted side effects and even hasten the path to a cancerous condition if given under the wrong circumstances. So it's important to have a comprehensive evaluation before committing to hormone therapy. First of all, let's get on the same page. We need to fully consider and investigate cortisol and sex hormones in matters of energy, weight problems, and libido. To accomplish this, one must have a purpose-driven evaluation of the adrenal glands, the ovaries, and the testes. And today we're going to specifically focus on the adrenal glands. Adrenal glands are located on the top of the kidneys and produce hormones called cortisol, aldosterone, the sex hormones, and adrenaline and epinephrine. So the adrenals make steroids and amine hormones. Steroid hormones are derived from cholesterol. They're lipophilic and they diffuse across cell membranes easily. These include the sex hormones and cortisol. So an interesting question in the future for future discussions would be, do statins and cholesterol medications affect these hormones, and more importantly, do they affect you? Amine hormones are known as epinephrine or adrenaline and norepinephrine, and are water soluble and come from tyrosine and dopamine. So let's focus on the stress response here. So stress begins in the central nervous system or the brain, but it manifests peripherally through the autonomic nervous system. Stress can be brought on by anything that disturbs a calm state. The stimulus can be emotional, physical, psychological, environmental, chemical. The fight or flight, that ship is sinking, or that running from the tiger state of mind that can lead to immediate and long-term alterations in your hormonal state. That is what's known as being disturbed from the calm state. That is stress. So where does it all start? It starts in the brain. The hypothalamus produces CRH, also known as corticotropin releasing hormone. This in turn stimulates the pituitary gland to produce ACTH, which in turn stimulates the adrenal glands to produce hormones called cortisol, DHEA, aldosterone, and norepinephrine, epinephrine, adrenaline. So cortisol is the long-term stress hormone, and DHEA is a precursor that produces the majority of sex hormones in the body. And then norepinephrine and epinephrine are the immediate stress hormone, and they tend to be short acting. Aldosterone, another one of the hormones produced by the adrenal gland, is responsible for maintaining sodium and potassium balance. It affects the blood pressure, and it affects many other mechanisms of action throughout the body. So although there are many rare and extreme conditions that affect adrenal function, like Addison's disease, which is an autoimmune condition where the adrenal glands are just not functioning and are not putting out hormones like cortisol and aldosterone. This was the condition that President Kennedy had. And then Cushing's syndrome, where there's increased cortisol, but it's due to exogenous steroid use. So it's from chronic steroid use that you get Cushing's syndrome. And then there's Cushing's disease, which is when you have a tumor that's actually secreting cortisol. These are extreme conditions, but usually it's generalized dysfunction of the adrenal gland, which is much more common in the population and manifests with energy, weight, concentration, and libido problems. So evaluating dysfunction of the adrenal gland requires knowing how much cortisol is being made by the gland, how much of this cortisol is free and unbound and available for use by the body, how much is metabolized to its inactive state, and knowing what one's diurnal or circadian rhythm is. Chronic use of steroids, opioids, things like Accutane for acne, anorexia, traumatic brain injury, and having poor liver function can cause decreased cortisol. But it often can be caused by hypothyroidism. And the hypothyroidism can be present months before it ever gets diagnosed off of routine blood work. Long-term stress, inflammation, infection, pain, obesity, insulin resistance, and high thyroid hormone levels can cause increased cortisol levels. In the adrenal cortex, there are 3 zones that produce hormones. ZG, the zona glomerulosa; ZF, zona fasciculata; ZR, zona reticularis. Each of these produce aldosterone, cortisol, and DHEA. So from this one gland, there are 2 major hormone contributors to people's sense of well-being. That's cortisol and DHEA. So 80% of DHEA, which is the major precursor to sex hormones, is produced in the adrenal cortex in men and women. Decreased levels of DHEA can cause malaise, extreme fatigue, joint pain, lowered immunity, decreased bone density, decreased libido, decreased muscle mass, and a feeling of being overall depressed. In men, almost all of the sex hormones are produced in the testes, but for women, 50% of androstenedione and 25% of testosterone are made in the adrenal glands through the production of DHEA. So androstenedione is a steroid hormone that has weak androgenic effect, but is the precursor for manufacturing testosterone and estrogen. It is responsible for increased energy, improved recovery, growth from exercise, increased libido, decreased body fat, and it helps to keep red blood cells healthy. Obviously, low levels will have the opposite effect. Most importantly, increased cortisol from chronic stress can push allocation of resources in the adrenal gland away from the zones that are usually responsible for producing DHEA, and therefore cause a depletion of sex hormones, creating a major imbalance. To understand what role hormones are playing in your decreased energy, vigor, difficulty losing weight, and poor libido, and poor concentration, you need purpose-driven testing, looking at cortisol, DHEA, in their active and inactive forms. From that, one can understand if it is a production problem, a free and available problem, a deactivation problem, a circadian rhythm problem, or all of the above. More often, it is adrenal issues that need to be corrected and not hormone supplementation that is the best route to supercharging your energy and feeling revitalized. So click below, make a free 20-minute appointment consultation to see if WPR Medical can help you, and join our private Facebook page or visit our natural health and immunity store. See you next time, WPR Medical.